Okay, hi guys. I am here with my sweet baby Sebastian, and I just wanted to tell you guys what is going on with me. So yesterday I woke up and everything was fine, but I noticed that my right eye was blurry, and I just thought, oh, I just woke up. Maybe it's just because I need to wash my face and, get ready for the day, whatever. So I went into the bathroom and washed my face and wash my eyes out, because sometimes you have sleep in your eyes when you first get up and stuff. So I did that, and then I came out of there and I noticed that my right eye is still blurry. Like I can see, and I can even see out of my right eye. It just looks like there is, the best way I can explain it is it looks like I'm looking through fog in my right eye. So I started panicking, and one of the first things I did was I sat down and I kept rubbing my eye, just thinking that maybe it was because I just woke up. And then I realized it was not going away. So I sat here for about an hour and I searched up reasons why your eyes could be blurry. And the first thing that showed up was that you could have had a stroke. And the night before that, I was having some chest pains, but nothing really bad. But I had been having them every once in a while. I just kind of chalked it up to heartburn. So I started panicking because I have had a stroke in the past, about 6 years ago. So I was like, oh my God, I hope I'm not having another stroke. So I told my mom about it, and she took me out to the emergency room. So we was out to the emergency room from 8 a.m. till near 5 o'clock. And they did brain scan tests, they did x-rays, they did blood tests, they did all kinds of tests on me to see if there was anything going on in my brain. I was scared that I had I was either having a stroke or I had like a tumor in my head that was causing vision problems. But everything came back fine at the hospital. So the doctor called the eye clinic right away and sent me over to the eye doctor, and he did all of his tests. And he looked puzzled. He looked like on his face like, I could tell that there was something wrong. And then that scared me even more, like, oh my gosh, what did he find? And then he done probably 30 minutes worth of tests, and then he came back and started talking to me, and he told me and my mom that I have what is called, hold on, I have the thing pulled up. I have what is called vitreous detachment in my eyes. And he said, what is crazy is usually you don't see this in patients younger than 50, and usually older than that, like 80-year-olds usually get this. So he's like, I have no idea why a 39-year-old person would have this, especially a 39-year-old person that has never had eye issues. I've never even needed glasses. So you could tell that he was like, what in the world is happening? She should not have this. She's never had any eye problems. She has 20/20 vision. She has good vision, and she's not in her he said he's seen it in a couple of 50-year-old patients, but most of the time it's in 80-year-old patients. So what it is I have it pulled up right here. What it is a vitreous detachment is a separation of the vitreous or gel that fills the back of the eye from the retina. Symptoms of a vitreous detachment includes flashes and floaters. The biggest concern when a vitreous detachment occurs is the risk of developing a retinal tear that can lead to retinal detachment. Now let me click on it and get more information. But this really freaks me out. I can see out of both my eyes. So it's really annoying because at some points I'm seeing a little bit double, but my left eye is completely fine. And then, okay, now I'm going to read a little more. It says, I now understand what vitreous detachment is. What is the cure or fix for the disease, if any? Is there any treatment available to improve the condition? Question. Answer. A vitreous detachment is a separation of the vitreous gel that fills the back of the eye from the retina. Symptoms of the vitreous detachment includes flashes and floaters. The biggest concern with the vitreous detachment occurs is the risk of developing a retinal tear that can lead to the retinal detachment. It is important to see an eye doctor if you develop the signs of vitreous detachment to be sure you do not have a torn retina. Often these bothersome parts of the vitreous detachment, the floaters, will improve within time. It can take 3 to 6 months for them to improve. If they persist for longer and have an impact on important activities like reading or driving, then surgery to remove them can be considered. Because surgery can have potential complications such as formation of cataract, retinal detachment, bleeding, and infection, among other things, it is important that the floaters are significant and severely impairing your activities. Right now, I can still function normally. It's just, I feel like there's something covering my eye some. So it is annoying, and there was another thing. They said that it usually goes away after that. Let me see if I can find the other page. He said it usually goes away, so I don't really have nothing. He told me that he would make me an appointment in St. Louis if I wanted to, because that's where I would have to have surgery if it doesn't go away. But he said the surgery is very, very dangerous, and so a lot of people don't want to do it. But if that's what I need, I'm going to see him again in a month to see if it is any better. All right. Risk factors. Who is at risk for vitreous detachment? A vitreous detachment is a common condition that usually affects people over the age of 50 and is very common after age 80. People who are nearsighted are also increased risk. Those who have a vitreous detachment in one eye are likely to have one in the other, although it may not happen until years later. Symptoms and detections. What are the symptoms of vitreous detachment? As a vitreous shrinks, it becomes somewhat stringy, and the strands can cast tiny shadows on the retina that you may notice as floaters, which appear as little cobweb or specks that seem to float about in your field of vision. If you try to look at these shadows, they appear to quickly dart out of the way. And I am having that, but I am also having what he said as cloudy. One symptom of vitreous detachment is a small but sudden increase of the number of new floaters. This increase in floaters may be accompanied by flashes of lightning or streaks in your or side vision in most cases. Either you will not notice a vitreous detachment or you will find it merely annoying because of the increase in floaters. What I am having right now is super annoying. I can handle it. I just hope it goes away very soon because I don't know. It's very annoying to me. Okay, and this says, how is vitreous detachment detected? The only way to diagnose the cause of the problem is by dilated eye examination, which my doctor did do. If the vitreous detachment has led to a macular hole or detached retina, early treatment can help prevent loss of vision. Now, he did say that I have a couple macular holes, but they're not real bad, and he thinks they'll go away on their own. Treatment. How does vitreous detachment affect vision? Although a vitreous detachment does not threaten sight, once in a while some of the vitreous fibers pull so hard on the retina that they create a macular hole or lead to a retinal detachment. Both of these conditions are sight-threatening and should be treated immediately, which is true, but he said mine are very tiny and he don't think they're going to get bigger. If left untreated, a macular hole or detachment retina can lead to permanent vision loss in the affected eye. Those who experience a sudden increase in floaters or increase in flashes of light in vision should have an eye care professional examine their eyes as soon as possible. But that's not what I wanted to show you guys. I'm trying to find the one. Anyway, he said that he thinks that it will completely get better after a month or so. That he knows that it's just annoying. But it should be okay. But I did read it. Okay. Let's see. As you get older, a gel inside your eye called vitreous gel can shrink. It can slowly detach, pull away from your retina. That's the nerve layer in the back of your eye that helps you focus on the image you see. Vision problems caused by PVD usually get better over a few weeks. In fact, many people don't have any symptoms, so they may never know they had it. I'm definitely having symptoms. It freaked me out a lot. All right, let's see. Your vitreous gel is mostly made of water for much of your life. It's right up against your retina at the back of your eye, near your optic nerve. Tiny fibers attach the gel to your retina. As you get older, little pockets can form inside these gel. The tiny fibers that hold it to your retina can break. That can cause it to pull away from your retina and optic nerve. As a result, you can get a tear in your retina or a hole in your eye nerve. Most people get PVD at 50 or older, and it's very common after 80. It happens to men and women equally. If you are nearsighted, have had cataract surgery or some kind of trauma to your eyes, you could be at higher risk for PVD. I haven't had any of them, so I don't understand why this is happening, but he said that he is almost for sure that when I see him next month that it should be better. Okay, symptoms. It doesn't happen in all cases, but PVD can cause changes to your eyesight. You may start to notice tiny dark spots that move around in your vision. They can look like flying insect hairs or cobwebs. These are floaters, and they're most common symptom of PVD. It's normal to have mild floaters from time to time, but if suddenly noticed lots of them, it could be PVD. Other signs are flashes of light and darkness around the edges of your vision. This could be a sign of a tear or detachment in your retina, which is often a medical emergency. You may notice symptoms in only one eye, but if you get it in one eye, you're likely to get it in the other within a year. Oh, yay me. Diagnosis. You should get an eye exam every year if you don't have symptoms or wear glasses or contact lenses. It's crazy because I have never, ever had any problems with my eyes. So I don't understand why but oh well, it happens. All right, your doctor may use drops to make your pupils bigger and use a slit lamp test to look for signs of PVD. This is done with a microscope that looks through the front of your eye. It can also show if PVD has caused bleeding, a torn retina, or something else that could harm your eyesight. But yeah, okay, treatment. The floaters or flash usually get better within 3 months, but you should have another dilated eye test 3 months after your diagnosis to make sure there isn't any new damage to your retina. If you have floaters for a few months, your doctor may give you the option to use the laser to reduce the floater or have surgery to take out the vitreous gel and clear the floaters. If you have a retina tear, laser surgery or cryopexy, which freezes the tear, can repair it. Oh my gosh. This is just scaring me even more. So hopefully, I won't have anything other than this, and it'll go away within a month to 3 months. But I am going to see him every month and go from there. So, yeah, I am really nervous. I can still see completely fine. The light kind of bothers me, and I'm definitely seeing floaters and cloudiness. So hopefully it just goes away soon. I can still work. I've been sitting here rooting. It is a little bit harder because it feels weird, but if I'm ever, I'll just close my one eye that has the floaters and still do it. I've been sitting here rooting this baby, so I don't think it's really going to affect me any. But it is annoying because I keep rubbing my eye thinking, because I forget, and I keep rubbing my eye thinking that maybe there's just something in it or something. But no, it stays the same. But anyway, I just wanted to do a video and tell you guys what I'm going through. I did not need this right now, but it is what it is. And if you pray, please say a prayer for me that this goes away sooner than later, and I would really appreciate it. So yeah, that was my nice update and crazy day yesterday. So I just hope I wake up tomorrow and it's gone. But we'll see. Either way, I'll be fine. It's just scary when it's your eyes. I mean, it's your eyesight. But things could have been worse. It could have been a brain tumor. It could have been something a lot worse than this. So I'm grateful that it's just this and that it will go away. And yeah, so that's all, guys. And I will talk to you later. Bye. Peace.